Hi, my name is Yvonne. I'm one of the nurses from the eye clinic. You have just had cataract surgery. You'll be given a discharge letter with a link to this video, which you can watch at any time. It's important that you follow the advice given to you by the nurse who is looking after you with regards to your post-op eye drops, and also if you need to continue any current eye drops. This video will give you some generic advice regarding how to care for your eye after surgery. Your post-op care will be either with your chosen optician or the hospital. The nurse who is looking after you will confirm this with you. At the moment, you will have some steri-strips holding the eyelid down with a shield over the top. This is to protect your eye following the anaesthetic. After 4 hours, you can take the steri-strips down. So the shield will be like this. You can just lift it up and pull the steri-strips down from the top to the bottom, and then pop the shield back on and retape it, and then keep that on for the rest of today and overnight. For the first 24 to 48 hours after surgery, you may notice that your eyelid's a little bit droopy. There may also be some bruising around the eye. This is all quite normal and nothing to worry about. You may also experience some double vision, which can last for around about 48 hours. Sometimes you may notice your eyes are a little bit more watery than normal too, and the tears could be a little bit blood-stained. Again, nothing to worry about. You may have a foreign body sensation in your eye, but this can last for a couple of weeks, and just try not to rub the eye because you don't want to scratch it. If you do feel any discomfort in your eye after surgery, just take your normal brand of pain relief that you would usually take for a headache. However, if the pain gets worse or doesn't go away, or there's a sudden loss of vision, or you notice an increased redness or swelling around the eye, it is then very important that you get in touch with either the hospital or your optician. For the next couple of weeks, wear the shield every night at bedtime. Protect your eye with your glasses, sunglasses or the eye shield when you go outside for a walk. This is to just avoid getting any dust or grit blowing into the eye, which could cause you to rub it. Avoid any strenuous activity such as lifting heavy objects, bending or stretching. You can go for a walk and watch television or read a book. None of these will harm your eye. Avoid washing your hair for the first few days after surgery. When you do so though, please make sure that you put your head back and wash it that way so that any soap and water runs backwards rather than going into the eye, which again could irritate the eye and cause you to rub it. If your eye does water a little bit, sometimes you may wake up in the morning, it might be a bit sticky. If that's the case and you need to clean the eye, just boil the kettle and let it cool, and then use a lint-free pad or tissue and just wipe away from the inside out to clean the eye. Don't use cotton wool though. You may be a bit sensitive to bright light or sunlight for a few days after surgery. If this is the case, you can just wear your normal sunglasses. However, if this sensitivity persists or gets worse, then please contact your optician. With regards to driving, we advise not to drive for at least a week after surgery. If you do need to drive before you see your optician or the hospital, just pop in and make an appointment with the optician to check your vision before you do drive, just to ensure that you're safe to do so. The nurse will give you some drops to take home, and also a little sheet that you can use to tick off when the drops are due and when you've done them. If you run out of the drops, you can contact your GP, who will have been informed about the surgery that you've had today. After this video, the nurse looking after you will give you your post-op eye drops. If you have any further questions that you'd like to speak to, or if there's anything that you need covering again from this video, feel free to ask the nurse at that time. And there will be numbers available at the end of the video and also on the discharge sheet. Thank you for listening.